The level of health of our mouth directly affects the level of health of our body and vice versa. And so, we used to look at infection, at gum infection, gingivitis or periodontal disease. It really doesn't matter. Periodontal disease is just gingivitis. It's been there longer. But we used to look at it as a debris problem. But now we understand it's more of a host immune response, biofilm, and bacteria problem. So it's the three things put together, which is also why we can have patients that have immaculate home care, but they bleed all over the place. I mean, doctor goes to do a crown, class 2 composite, and it's like, just where's all this blood coming from when this patient does such a good job? So we now understand that there's bacteria that causes that, and that bacteria makes the gum tissue leaky and permeable. The swelling does. So when we have bacteria that sits there, which is biofilm that sits there because the patient maybe is or isn't doing a good enough job removing it, but what ends up happening is the gum tissue gets swollen, it becomes leaky and permeable, which means then the bacteria in the mouth travel to the brain, travel to the heart, travel to the lungs, to the gut, to everything in our body. And that's how it can make the rest of your body sick.
Welcome to another episode of The Irreplaceable Dental Assistant. And today I went all the way to Tennessee to pull someone who is just going to bowl you over. Tosh, how are you today?
Oh, I am so good, and I'm so thrilled to be with you.
Well, I know a little bit about you, but tell us who you are, what you bring to the world. Just let our guests feel a little more comfortable as they listen to us chat for a bit.
Yeah, well, I am a dental hygienist, and I am also, now I am a full-time consultant, but I was sharing with you earlier that I was born and raised in rural North Dakota in a town of 1,500 people, the kind of town that has one grocery store and one pharmacy. And we were lucky enough to actually have the local dentist, so people came from miles around. And when I was about 10 years old, my mom actually was asked to be a dental assistant. And so she was trained on the job, and I remember from there just always loving going to have my braces adjusted. I mean, being the local dentist, they do everything from extractions to orthodontics to all the things. And so I just always remember, like, once my mom became a dental assistant, it was more fun to go to the dentist. I was no stranger to the dental chair. I grew up in a town 20 miles out of town, and it was only a tiny town to two parents that had really, unfortunately, terrible teeth. And at the time, I didn't realize, like, the hereditary component, but also the contagious component of it. And so I was no stranger to that dental chair. But once my mom was a dental assistant, it was like she had such a delicate hand, and her bedside manner was so good. And I'm sure I was biased because she was my mom, but she really was just so wonderful. And I think that kind of just ingrained my love for dentistry. I always loved my dental hygienist as well. And so from a very young age, I mean, I remember just always thinking that dentistry was always pulling towards me. And my mom's still dental assistant to this day. Okay.
So, Tosha, I know that you're a trained dental hygienist, but now you are a hygiene coach focusing on systemic health. How did you make that transition?
Yeah, it wasn't necessarily planned at all. But in college, I was just so fascinated by periodontal health and disease and the infection process. And so when I graduated, I just wanted to work for a periodontist. I wanted to specialize in just healing people's gums. And I was actually lucky enough to find a periodontist that was actually hiring, because I didn't realize in college how few of them there are. And I also worked for a GP practice that had 3 doctors and 10 hygienists. And the entire process was pretty crazy. I didn't realize just how many people had infection, and I didn't realize that even though the contrast of the two practices were severe, one's a specialty office, treating periodontal disease, everyone bled. It was really, really a hard job. And it really felt like I wasn't healing anybody. They were too far gone. And then at the GP practice, I was just doing bloody prophies all day long. And I'm thinking, like, there's got to be a better way. And so I relocated to Tennessee and found a dentist that was as passionate as I was about oral systemic and about doing it differently. And coincidentally, his father had just brought oral pathogen testing, so the bacteria that causes gum infection, he had just brought that testing to the United States from Germany. And so I had the opportunity to work for both father and son. So like one in more of a lab setting, to where I got to like look at these pathogen tests to understand really what was going on in patients' mouths and what was causing all this bleeding that I had been seeing for years. But then also clinically, I worked full time for the son, being able to treat these patients and look at infection different and see completely different outcomes. And then fast forward, I had the opportunity to co-teach alongside of him for about a decade. And we taught hundreds of practices across the United States how to just really look and treat infection different. And then I was just, after about a decade, I feel like I'm more evolved past what I was able to do there. And I just had a calling of that I just wanted to really take this full time and be able to inspire and really light up clinicians, because I saw in that practice that not only dental hygienists, but the dental assistants as well. I mean, from taking a plaque sample, putting it under a microscope and seeing what was in these patients' mouths and what was actually causing the infection was like, it just changed the career from like this treadmill hygiene that so many people are experiencing. And even the assistants as well, like they were doing the same thing as the hygienist was doing. Like everyone was an integral part of that entire process. And so it was kind of like one thing led to the next thing, led to the next thing. And I just kept following my bliss, so to speak. And it just kept getting better and better.
That is awesome. You know, we never know where we're going to end up, but if we are open to explore, it's amazing what can happen. So, Tosha, what is the oral systemic health connection, and why is it important?
Yeah, so it's really, put simply, it's just the connection between our mouth and our body. And really, the level of health of our mouth directly affects the level of health of our body and vice versa. And so, you know, we used to look at infection, at gum infection, gingivitis or periodontal disease. It really doesn't matter. Periodontal disease is just gingivitis. It's been there longer. But we used to look at it as a debris problem. But now we understand it's more of a host immune response, biofilm, and bacteria problem. So it's the three things put together, which is also why we can have patients that have immaculate home care, but they bleed all over the place. I mean, doctor goes to do a crown, class 2 composite, and it's like, just where's all this blood coming from when this patient does such a good job? So we now understand that there's bacteria that causes that, and that bacteria makes the gum tissue leaky and permeable. The swelling does. So when we have bacteria that sits there, which is biofilm that sits there because the patient maybe is or isn't doing a good enough job removing it, but what ends up happening is the gum tissue gets swollen, it becomes leaky and permeable, which means then the bacteria in the mouth travel to the brain, travel to the heart, travel to the lungs, to the gut, to the everything in our body. And that's how it can make the rest of your body sick. So the mouth is so critical in overall body health. And we now understand that a gum infection can trigger a heart attack or a stroke. And most of us don't understand that critical connection.
Yes, that is so true. And, you know, I feel that if we could just get the word out, it would make such a difference for so many people, because it's just, it doesn't take heart surgery to correct.
Yes.
It's not that involved. There's some basic things that can make a significant difference. So why is it important for a dental assistant to understand the oral systemic health connection? You're speaking from the experience of a dental hygienist, but help us put that puzzle together so my listeners who are primarily dental assistants can understand their role and what they bring to the table.
Oh man, I love this question so much. Well, I mean, I truly feel like, our dental assistants are such an integral part of each patient's oral wellness team. And usually the dental assistant is spending a lot more time with that patient than the doctor is. And so they have a huge opportunity to educate the patient because they're seeing the same thing that the doctor's seeing, but the doctor often doesn't have enough time to sit and spend with that patient about what they saw. I mean, they have to go do hygiene checks. They have another patient or two waiting in that next room. They have all the other parts of, running a practice. And so the dental assistants also get a lot more questions than the dentist does. And so I found that patients will ask the assistants way more than they'll ask the dentist for various reasons. So sometimes they feel like, I don't want to waste the dentist's time, or they really just want to kind of like in confidence say like,
yes,
I really need that or whatever it is. And so when the dental assistant has that elevated level of understanding, they can provide such amazing information for that patient. And if the dental assistant doesn't have that education, then the opposite is true. So if they don't understand these integral pieces of the puzzle, the whole practice really kind of loses those gems, like those really, really important pieces. And so, I mean, I feel like, man, like from the moment that no matter what person goes and gets that patient from the waiting room, it's like that's where that relationship and the conversation starts to dismissal. And I mean, those assistants, they work their booties off. And
yes, they do.
So important.
And they are truly the connectors. I like to refer to them as the glue.
Yes.
They form the relationships that will allow people to have confidence in the office because
yes.
Lisa is so good, and Lisa has all the answers. And, even when I don't understand what Dr. Lawson Myers is saying, Lisa is so good at explaining. And she's interested in my grandson and his basketball game from last week and the fact that I'm going on a girls trip, so yes. You build relationships, you build trust. So we agree, and we can underscore that our dental assistants play a critical role in just making our patients feel at home enough to listen and to hear. Yes. And to convince them that what we're saying is well worth doing. So what are some ways that they can stress the importance of a healthy foundation to our patients? Because, most people, they see a little bleeding, they're not really alarmed, especially if it doesn't come with pain.
Well, I think the first thing is just to keep the conversation really simple, meaning like using language that the patient already understands, not necessarily dental terminology. So I am really against dental terminology personally. And I think in dentistry, oftentimes we first try to teach patients our language, and then we try to explain the next part, where patients just if we just keep it simple, it would go a lot farther. So, for example, a lot of patients think once they get a crown, it's indestructible, they'll have it forever. Whereas if that patient has gingivitis or any type of inflammation, they're actually decreasing the life of that crown because the margins are bathing in bacteria and inflammation. And so I would suggest to a dental assistant to educate the patient by saying something simple like, Mr. Smith, the best way to get the most miles out of that new crown of yours is to just ensure that your mouth is really clean. We now understand that if plaque lingers around the gums, that means that bacteria also lingers. That causes swelling, and bacteria love swollen gums, and that swelling is going to decrease the miles you're going to get out of that crown. And so that means brushing your teeth twice a day, brushing teeth and gums. Use a water pick. That's even going to bring it up another notch. And I'm going to go ahead and show you what that great technique is. So just keeping it really simple, but helping that patient to see that investment that you made isn't going to last forever if you don't put in the work. It's kind of like, seeing your hygienist again twice a year to get your teeth cleaned, quote unquote. It's like working out twice a year. The patient sees themselves every day. If they're not going to keep up at home, then it doesn't matter if me personally, if I'm just the best clinician there ever was, if somebody sees me twice a year, it's not going to do that much good. So the same is true for all restorative, and patients, when they're spending their good hard money on all that restorative, it's if the foundation's full of termites, it's not going to last as long. So just keeping it simple and helping the patient to understand how they can really invest further by their home care.
You made so many good points. I'm going to take them one by one. First of all, I always say to my team, use dental terminology among yourselves. Use basic language to speak to the patients. Because if you're speaking above them, you're not going to be effective. And
Yes.
using terms that may sound intelligent, but they really don't understand, not helpful at all. The other thing is, I just love how you gave that example, which is really practical. Look, you just invested a significant amount of money in this crown. So here's what we can do to lengthen the life, because everybody wants to know that everything lasts forever.
Mhm.
And one of the things I always underscore is it will last as long as the foundation is healthy.
Yes.
And we always not only tell them, but we try to make sure that they're using the proper technique, soft bristle brush, angling it so the bristles get below the gum line, getting that floss in between, or using the floss threader to get under the bridge, if that's a bridge or whatever, to make sure that, you know, they can use the mirror and feel comfortable doing it. Because if you send somebody home to do something and they have it in their head, but that coordination with the fingers and the mouth and the cheek and the tongue,
Well, and I
if we
think
haven't
too,
mastered that.
well, and we, I think as dental professionals, we take for granted how good our dexterity is.
Absolutely.
We are working in little mouths all day long. Even if it's a big mouth, it's still a small space. And so we get so just overconfident in what we do because we've been doing it for so long sometimes, or even after doing it for a year, like it's much easier. And patients, it's just not the same. And so until we have them do it for us and we really show them and take their hand and do it the old fashioned way, just really, like you would do a child. Sometimes it's astounding how much the patient doesn't get that connection of like, oh, it's that angle that
Yes.
you're trying to get me to do. Oh, that's how I need to thread the floss, or
Exactly.
the whole thing. It's
Exactly.
keeping it. It's like going back to basics, really.
Keep the KISS rule, right? Keep it simple, stupid. Well, we wouldn't say stupid,
Yes.
but you know what I mean?
Absolutely.
So, Tasha, what is one thing that you wish that all dental offices would do as it relates to the oral systemic health of a patient?
Well, I think that a large part of it well, let me go back. So I think a large problem in dentistry is that we've normalized bleeding.
Yes.
And for the most part, we've been taught that gingivitis, periodontal disease, whatever, they're the same problem, is a debris problem. And so for me personally, I wish every practice would incorporate using a microscope chairside. A hygienist can do it, an assistant can do it, because if people just saw on a daily basis what was swimming in their plaque, the pathogenic bacteria that doesn't actually belong in our mouth and should never be there, I don't think we would just so simply say, go home and floss more, Mr. and Mrs. Patient. I think we would have a much better understanding of it, because seeing is believing in so many ways. How many of us would like to explain what a failing amalgam looks like versus just showing them a photo of that failing amalgam?
That's
it's
true.
just it's so radically different. And so any area that we can show a patient versus tell them, I think is going to be of huge benefit, because dentistry isn't just tooth care, it's health care.
It is.
And every day, all of us have the opportunity to save lives, because we now understand that gum infections can trigger a heart attack or a stroke. And simply by teaching a patient how to do better with brushing or flossing or using a water pick or just any of those simple tools is super, super critical. And so I think that, we have to almost slow down and go back to what feels, old fashioned and simple to a lot of us, because people understand now that there's some kind of connection there, but that connection is really difficult to understand. And I've found that, because of seeing is believing. And so now that's why I've really gotten behind like using microscopes chairside. that's been something that was, we had those abilities in the 80s to use a phase one dress microscope. And so, when I can show a patient spirochetes swimming around in their mouth, and they go, oh, and I say, oh, this explains the changes I was seeing in your gums today. They're like, yes. What are you going to do about it?
Yeah.
Like, oh, thank goodness. Yes. What am I going to do about it? Let's work on this together versus like 1 to 3 millimeter pockets is normal. Healthy gums don't bleed, blah, 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 blah. More dental terms.
Making it real is the key.
Yes.
They can see, because let's face it, Tosha, if I do not feel pain, no matter what I'm seeing, I just naturally minimize what it could be. Because if it was really bad, it would hurt. And since it doesn't hurt, it can't be that bad.
Absolutely.
And we know that a lot of damage can occur because before a patient even has a clue that something is going wrong. So
absolutely. It's, and so much of the mouth is silent until it's really just almost too far gone. In some cases, it's completely silent. And it makes sense because we have to eat to stay alive. And, high blood pressure doesn't hurt either.
That's true.
It's too far gone.
That is true. So it's interesting that you should mention that, because I always say to my patients, like, something that can really be serious can be silent for a long time. And that thing is high blood pressure. And most people know if somebody dies of a heart attack or a stroke, it may have something to do with the blood pressure being high. So then I say, well, something similar can happen in your mouth, and it can make your teeth loose, and you can lose your teeth prematurely without even recognizing that something was going south, because you don't necessarily feel any pain. So we're on the same page. We try to make connections that people can relate to and understand.
Yeah. It's so important. I know I always used to tell my patients with high blood pressure, I'd take the cuff, and they'd be, oh, it's only high when I'm here. And I'd say, well, did you know that actually over 65% of the time, white coat syndrome actually turns into hypertension. And, it's like driving down the road 70 miles an hour in third gear. How long's that clutch going to last?
That's right.
Not very long.
Well, the truth is that there are some people who will hear what you have to say the first time and they'll adjust. There are some people, it's not until the umpteenth time. We have to really be prepared to mention it every time. Because what I find is that human nature is, okay, I've told her about it 5 times and she hasn't done anything about it, so I'm just not going to bother to mention it. And that is the opposite of what we should be doing, because maybe the 10th time she's going to say, oh, all right.
Yes.
Or there may have been somebody close to her or him where something happened, and finally they're joining the dots and recognizing. So, this has been such a fruitful conversation. I feel like we could stay and chat for a long time, but I do know that we have limitations. However, I always ask my guests if there is a quote that they'd like to share, because it's just such a wonderful way to end a conversation. Do you have a quote that you'd like to share with us today?
I do, and it's from Maya Angelou, and I may get it not 100% right, but it's something to the effect of, we do the best we can until we know better, and then when we know better, we do better.
That is so to the point. Everybody can relate to that. Just do the best you can until you can do better. And we, along our path, will make sure that you know the things to do better. Right, Tosha?
That's right.
One more thing. If my listeners would like to connect with you, what are the best ways to find you?
Yes, they can find me on Instagram, which is at Tosh, TOSH.care, CARE. Or on Facebook at Tosha Kozloski RDH. And my website is just www.tosh.care.
All right. Miss Tosh.care, this was a pleasure. You have to promise me one thing.
Yes, ma'am.
That you'll come back another time and share with us.
Oh, I would love to. This has been so much fun.
Thank you so much. Well, all right. This connection between our mouth and our body, otherwise known as the oral systemic connection, is so important for our patients to understand. They need to understand that bacteria in our mouth can travel to other parts of the body and cause harm like heart attacks and strokes. Listen, why does the dental assistant need to know these things? Because they often have the opportunity to sit with the patients and chat more so than the dentist and other healthcare providers would have. The more the dental assistant can share, the better for each one of our patients. Listen, remember to keep the conversation simple. Use simple terms so that everybody understands and nobody feels as if you're speaking over their head. And finally, remind our patients that the investment that they make in our crowns and implants can only last as long as the healthy foundation on which they rest. Bleeding is never normal. If you want to hear more from Tosh, check out her website on tosh.care. Listen, you know I say life is better when we live, laugh, and grow together. See you the next time. Blessings.